today to share more about the PA program and what makes an applicant competitive. Following this presentation, we will entertain some of your questions. So please type your questions in the Q&A box for our guest speakers to answer live. So joining us today, we have Ms. Tria Smith, our other School of Medicine recruiter, Shirley McGraw, our Administrative Operations Manager and guru for everything admissions for PA. We're also joined by some amazing PA faculty recruiters, Professor Carla Hirsch, Professor Dora Hawkinson, Professor Christy Cobalt, and Dr. Julie Kutek. So please help me welcome Dr. Kutek.
Hi everyone, it's great to virtually see y'all. I'm going to share my screen. And I am happy to talk to y'all about PA studies at UTMB. So let's begin for those of you who may not know what a PA is or what a PA does. PAs extend the reach of physicians, and they do so many different services. They conduct physical exams, PAs diagnose and treat illnesses, they order and interpret tests, assist in surgery, prescribe medications, they counsel and educate patients. So you can see that a PA is a critical part of the healthcare team. And one question that we receive a lot from folks who are interested in the PA profession is what makes a PA different from, say, a nurse practitioner? And while both are advanced practice providers, PAs are trained in the medical model. And so you will receive a similar education to what a medical student receives, but it's at the master's level instead of at the terminal degree level of the MD. But PAs have great autonomy. They practice autonomously and work with physician oversight. So they augment and extend physician reach, particularly into primary care areas and into rural healthcare areas as well. But having said that, PAs provide care in lots of different specialties. There are PAs in hospitals and outpatient clinics. PAs practice in both the rural and the urban settings. They practice in nursing homes and at universities and industrial settings. We have PAs who practice at correctional institutions. And one of the interesting things about UTMB is that there are clinical rotations that are done in the TDCJ hospital. So that's one unique aspect of your education. And PAs also work in the armed forces. So with a degree in physician assistant studies, you have quite a lot of flexibility and freedom to practice in lots of different areas and lots of different settings. So here is a beautiful picture of our class of 2021 when they received their white coats. The mission of our program at UTMB is to develop and graduate academically and clinically exceptional physician assistants. We are an accredited PA program, and our accreditation will be continued until the next validation review, which will happen in 2027. So you can see we will be accredited for quite a while into the future, and we have no expectation that that would change anytime. So let's go into a little bit more depth about the PA program. So once you have graduated, you will receive a master's degree in PA studies. We generally have a class of about 90 students. Anywhere between 88 and 92, but 90 is right at the number. It's a 26-month curriculum that's broken into 2 sections. There's a didactic year and a year of clinical rotations. And then students return back to campus prior to graduation for some more intensive didactic coursework, preparing them for advanced issues that they may see in practice. We prepare all of our students to take the PA National Certification Exam, which is called the PANCE. And the PANCE allows you to become a certified PA. We are very proud that our 5-year first-time taker average pass rate, so these are students who are graduates who are taking the PANCE for the very first time. Over the past 5 years, our average has been a 98%. We have always fallen at or above the national average of PANCE test takers. So what does it take to get into PA school? This is a very busy slide, but let's break it down a little bit by. Of course, the tip is that your advisors can help you evaluate your courses and make sure that you have met all of your prerequisites. So we require that students have 8 credits of biology, 4 biology majors, including lab. Students need 8 credits of chemistry. They need 6 credits of behavioral sciences. Most often, students take these courses in sociology and psychology. You're required to take 4 hours of either organic chemistry or biochemistry. And you can see that that's only 1 credit semester of organic. You'll need to take 4 hours of microbiology or bacteriology, and 3 to 4 credits of either immunology or virology. In the past, UTMB accepted nutrition as a substitution for the immunology prerequisite, but moving forward with this cycle, nutrition, immunology, or virology. And we have found that having a rich understanding of the basics of immunology or virology prepares you well for the pathophysiology that you'll be learning in your didactic year and that you'll be practicing as you move into your clinical rotations. Students who have not had immunology or virology tend to struggle more. So this isn't just like a moment of trying to get you with another hard course, but rather it's that we want you to feel absolutely prepared and ready to hit the ground running when you come into class. We require 8 hours of anatomy and physiology, 4 hours of anatomy, 4 hours of physiology. We require 3 to 4 credits of genetics, although the genetics lab is not required. 3 credit hours of statistics, and 2 or 3 credits of medical terminology. So we feel like this prepares you, but I also want to say that the courses are a huge component, but courses aren't the only thing that make a student competitive in PA school. New for 2020 this year, we will be requiring the Casper test. You can go to our website and get more information about taking the Casper test. And this year, we'll also be offering the opportunity for students to take the new Physician Assistant College Admissions Test, the new PA CAT. It's optional for this cycle. You're not required to take the PA CAT to receive an invitation for an interview, but it is recommended, and we encourage you to do it, but it's not required by any means. Casper, however, is required. So looking at the characteristics of our admitted students, in the class of 2021, we accepted 92 students, 82% of which were female. It's a strongly female class, but don't let that dissuade you. If you are not a female, we look at every application on its own merits. Absolutely. We just have lots of females who are applying to PA school these days. 98% are Texas residents, and the average student age is 25. So you can see that students coming into PA school are a little bit older than the average person who's graduated fresh out of undergraduate university. The overall GPA is a 3.66, and the average overall GPA is a 3.66, and the average science GPA is a 3.58. Having said that, we look at people cumulatively. So some students may have a bit of a lower GPA, but they have significant amounts of clinical experience. On the other hand, you may have a student who has a stellar GPA, but doesn't have as much clinical experience. So we look at each application on its own merits. And so don't let these numbers dissuade you or scare you, but rather they're just here to help you paint a picture. And for quantitative. Here are pictures of our faculty, our leadership team. The PA department is headed by Dr. Bob Philpott, who is well renowned and well esteemed within the national PA community. He has served as on the accrediting body of the ARC-PA as a site visitor for many years, and he knows all of the ins and outs about what makes a stellar curriculum. Dr. Robert Beach, Bob Beach, is our medical director. Dr. Beach comes to us from the School of Medicine faculty, where he's faculty emeritus. He is a nephrologist by training, but really the word that we should use to describe Dr. Beach is guru. He is a wealth of knowledge and experience, and he deeply, deeply loves teaching the next generation of students. So, you know, every so often you meet those people who are kind of living legends, and to have the opportunity to work with both Dr. Philpott and Dr. Beach is a real honor. Gary Perez is our Associate Program Director. Marcy Contreras is our Director of Didactic Education, and Darcy Ortiz is our Director of Clinical Education. All three of them are wonderful resources. They have great expertise and an abiding interest in helping students succeed. So why UTMB as opposed to other schools? There are other schools that have smaller classes. There are other schools that are within large urban areas. And so UTMB is unique, and it might be the right fit for you. And I want to talk about some of our strengths from a number of different perspectives. So one of the strengths of the UTMB PA studies is the strength of our faculty. So even though there are on average 90 students in a class, that's a really large class. But we still have the small kind of community feel. You know, Galveston is a small community, and we like to foster that individual focus. So when you arrive at UTMB, even before you matriculate, you'll be placed into a faculty coach learning team of 6 or 7 people. Every student has a faculty coach. My faculty coach team has my cell phone number. We have a text thread going, and we meet once a week. And the same is true for each faculty coach learning team. So it's your opportunity to have a direct line and to the faculty members, and to also foster that mentor-mentee relationship where you know who to come to if you have a question. And we have bonded, we have studied together, we have played together, we've gone to see plays together. And so there's a real camaraderie and community focus that's developed. Our faculty is large and diverse, and every course that's taught is co-directed. So you don't have one person running a class for 90 people. Each class is co-directed, and so that shares both it shares the burden of teaching load. But what it also does is that for students, it provides a variety of perspectives and a variety of expertise. So, for example, in thinking about the diversity of our faculty, I am not a PA. My background is in medical humanities and medical ethics. We also have a PhD pharmacologist on our staff, on our faculty, and she and I are co-directing a course on applied research. We have faculty members who practice clinically. These are not faculty members who left the clinic for academia 75 years ago and they haven't been inside a clinic. We have faculty members who take a day out of their week each week to go and practice the skills and the concepts and the critical thinking that they're then coming to you and teaching you. So we think that that provides a real cutting edge perspective for our students. And we have faculty who practice in the emergency room. We have faculty that practice in critical care settings. We have faculty that practice in primary care settings. So there's a diversity of experience. We have PA faculty who have worked in palliative care, who have worked in gerontology and geriatrics, who have worked in pediatrics, who have worked in GI, who have worked in orthopedics. So a large diverse faculty of people who are not doing the same things. And what does this faculty look like? The diversity of the faculty represents the diversity of our students. So we're very proud of the team approach that we take and that we are able to work together to benefit you, the student, because our shared common goal for all of us is to graduate academically exceptional and kind, competent PAs. We also have what we feel is a very strong curriculum. We have as I mentioned before, our curriculum is broken up into the didactic and the clinical year. In the didactic year, you'll have access to the cadaver anatomy lab. Every student will work on a human body who's been donated to science by generous families. You'll be able to participate in interprofessional education. There are the IPE, Interprofessional Education Scholars. That's an opportunity that's available to you. We also have large-scale simulation events where you're working with other students across the schools, in the School of Nursing, the School of Health Professions, and medical students within the School of Medicine. We have a global health elective that is also team taught. We have live Muda Gouda teaching. These are standardized patients who have received extra training, and they use their bodies to teach the genitourinary tract exams and reproductive exams. We have our beautiful new health education center that has a whole virtual simulated clinic, including rehab, critical care, and inpatient hospital setting. This is all state-of-the-art equipment and opportunities for you to work in a safe environment to practice the skills that you're learning, but in a low risk but high reward setting, in that it's very realistic to you. UTMB's curriculum engages with both problem-based learning and team-based learning, which are both evidence-based pedagogical practices that help you to start thinking critically even before you get into your rotation. We're also excited this year we have adapted and streamlined our didactic curriculum to include a 3-part course called Diagnostic Medicine. This is a systems-based approach to learning. So while you're taking courses in pharmacology and clinical medicine, that will be matched up with the system of the body that you're learning within diagnostic medicine. So while you're working on the kidneys, you're learning about the drugs that work on the kidneys. You're learning about how to palpate, things like that. Before your clinical rotations, you'll receive more training and a boot camp to help you prepare and get ready for the rotations that you're going to be participating in. And I'm now, to talk more about the clinical rotations, I want to invite Professor Hawkinson, who's on our clinical team, she's very involved and engaged in the clinical year. So I want to invite her to share her good wisdom about the clinical rotations.
Thank you, Dr. Kutak. Can y'all hear me okay? Wonderful. So as Dr. Kutak was pointing out, we have paired faculty, we have teams on our courses, and health promotion and preventive medicine, and also pharmacology. But I'm clinical director for one of the blocks for our clinical courses. I'm clinical coordinator for women's and children's and elective rotation course. And so as we were talking about, clinical skills training, boot camps, we have a bit of a preparatory course before the students go into their clinical rotations. We'll have a clinical preparation course and also boot camps for the students to help them with hands-on skills as they proceed, they're getting ready for their clinical rotations. It's a chance for the students to learn the procedures and become ready for, better prepared for their clinical rotations. We have 4 blocks of rotations in the senior year for our students. These are spread over Texas as being we have our base so that we have many opportunities, many established rotations with physicians, psychiatrists, surgeons, physician assistants, certified nurse midwives on our campus at UTMB. But we also have rotations out in the Dallas area, Austin. We have a hub in Victoria. We have rotations as far out as another beachside location like Corpus Christi. We have a wealth of established rotations for our students, and they are in the 4 areas. We have the surgical and emergency medicine rotation block. That is consists of 3 rotations that are 4 weeks each. And the students have general surgery. They'll have a selective rotation, which can be ortho, cardiovascular, plastics, as plastic surgery. As Dr. Kutak mentioned, we have rotations in TDCJ, so the Texas Department of Criminal Justice. We have a wide variety of rotations within each of the blocks. And we have, at the end of each of the 4 blocks, end of rotation exams that are specific to that block, such as emergency medicine and surgery for surgery and emergency medicine block. Women's, children's, and elective block, for which I am the clinical coordinator, has OB-GYN as one of your 4-week rotations. You will also have a pediatric rotation, and you have a choice for an elective, not a selective, but an elective rotation. This can be a wide range of what a student has a particular interest in. So moving on, we have an end of rotation exam for each block. So there's a women's health and there's a pediatric end of rotation exam. There's an internal medicine block. So that is more of inpatient based. That's going to be internal medicine, and then your specialties such as there may be a gastroenterology rotation or geriatrics or endocrinology. You have a chance to get different experience, and the students will put their preferences for the areas that they would most like to be able to have a rotation in. We also have primary care as one of the 4 blocks. That is the block that contains also the mental health rotation. And you have a chance for, this would be more like perhaps asthma, allergy type of rotation that's you may choose from in that block. What I'm trying to get at is that you have within these blocks courses that you will take along with some variety and some selectivity in your clinical rotation for each of the depending on the specific block that you are completing. You have a lot of choices. You have various areas that you are able to travel out to for the rotations. And I think that I've already mentioned the variety of healthcare professionals that these students work with, but it's also interprofessional education. They're working with medical students and other providers at the sites where they are rotating through. This is a little different for me. I'm used to talking to an audience and looking at them and being stopped with any questions or looking directly at them to see what they think about what I'm saying. I'm really glad, Dr. Kutak, that we're going to have, a chance for any questions to come through. I think that's primarily what all I wanted to cover for the surgery blocks. For the rotation blocks.
Yeah, great. Thank you. I'm excited for questions too. It's so much more interesting to, hear other faces when I can only see my face right now. So yeah, you can see you will have over 26 months of your curriculum. You're going to have a wide variety of experiences. You're going to learn pathophysiology, pharmacology, clinical ethics. You're going to learn about communication skills, and you're going to take all of that with you and all of those critical thinking skills that you develop in your first year and have a real chance to practice it on your clinical rotations. And the rotations are so varied that will give you a huge amount of experience too, of seeing how different healthcare systems work and run. And so I'm grateful to Professor Hawkinson for sharing her insight into all of this. And it makes me excited, just excited for the education that y'all are going to receive and the great experience that y'all are going to have. So along with the strength of faculty and the strength of the curriculum, I want to share a little bit about the strength of the campus. So UTMB is Texas's oldest medical school, and it's one of the oldest medical schools west of the Mississippi. It has both an educational focus, but it also has a focus on clinical and biomedical research and the practice of medicine. UTMB is a member of the Texas Medical Center, and it's affiliated with MD Anderson Cancer Center. And you may, if you live in this part of the world, you may have seen that there are now 5 hospitals in the UTMB health system, in Angleton, Danbury, in League City, in the Clear Lake campus, and the home campus in Galveston. Galveston is also home of the Galveston National Laboratory, one of only a few major laboratories that houses extremely virulent specimens and does research. They're doing research right now on COVID-19. They also have done research on SARS and MERS, as well as Ebola. UTMB is also home of the Moody Medical Library that contains within it the Blocker History of Medicine collection. One of the things as a medical humanist that is so exciting to me is that UTMB houses one of very, very few copies left of the Vesalius de Fabrica, one of the oldest anatomy books from the 15th century. UTMB has a copy of the Vesalius de Fabrica in its collection. So coming to UTMB is like stepping into a legacy. You know, as being part of the oldest medical school in Texas, and to be part of that legacy of healthcare providers who have gone before you, and to pave the way for the healthcare providers that will come after you, is a really neat and special part of the Galveston and UTMB experience. We also have a strength of our community. Galveston is a smaller community, but it's a very diverse community, and it has a personality all its very own. So we have a historical district with lots of community events like free art walks, where the art galleries on Post Office Street open up and you can wander in and out of the art galleries. There's Oktoberfest, which is a huge festival that's put on at the same time as Oktoberfest in Germany. We have the motorcycle rally. We have Dickens on the Strand. And we have the second biggest Mardi Gras. We call it a more family-friendly Mardi Gras next to New Orleans. But what we also have, what I skipped over purposefully because I wanted to give it its own special time, is that we have lots of opportunities for community engagement by our PA students. There's a student-run free health clinic, and there are other community opportunities. So I want to invite now Professor Kobold to talk some about the community opportunities that are available to physician assistant students at UTMB.
Good afternoon, everybody, and thanks for joining us. We're so happy you could all be here, and very excited to have you and to talk about UTMB PA studies with you and the School of Medicine. Dr. Kutak had mentioned that the medical school is the oldest one in Texas and one of the oldest west of the Mississippi. We are also the oldest PA program in Texas, and so there's a very rich history and legacy as far as that goes. So one of the great legacies of UTMB and its PA studies program within the School of Medicine are the community outreach programs, and we have 7 of them. There's a student-run health clinic called St. Vincent's House, and it's completely student-operated. I go as a faculty advisor and practitioner there on the neurologic clinic every month, but the clinic is open every day, and they have specialty clinic and internal medicine clinics throughout the week and throughout the month. That is an opportunity for you right out of the gate. The week you matriculate, you can start volunteering there and seeing patients. So it's really exciting for students to be able to learn and get their hands on while they're actually starting to learn medicine. We also have a program that Dr. Kutak and I advise on, an outreach program called Healthy Living on a Budget. And it's a very exciting and a strong partnership with the food bank here on the island. And that program, all of these programs have been in place for many years. And so the Galveston community really relies on us to provide these services to them. They count on us. They look forward to it. And it's really been our privilege to serve them. So the one that Dr. Kutak and I participate in is called Healthy Living on a Budget. I believe Professor Hawkinson advises Tooth and, or is it Ronald McDonald House? I've gotten you confused, I think, with Miss Ortiz. But we have different faculty advisors for the student-run community outreach, and they're providing medical care and services to the people of Galveston. So we have dental clinics, we have a relationship with the Shriners Burn Hospital and Ronald McDonald House, and these are all ways that you can immediately serve patients and their families once you matriculate into the program. And you have a lot of faculty support. These are important programs, not just to us as faculty, but to the university.
It's amazing to see what kind of growth can happen and what kind of community can be built when you're out there doing that service work. So I know that many of you have experience volunteering and serving already, and we just want to assure you that that is something that you can continue to foster and cultivate when you come to UTMB. So as we start to sort of wrap things up and start moving towards the question and answer session, I just want to say that UTMB is a particularly valuable education. It is expensive to become a PA. We understand that, and we don't take that lightly. But the tip is that the investment is worth it. The median salary for certified PAs is over $108,000 as of the last information that was released. And of the 93 baccalaureate, master's, and doctoral degree granting institutions, 91 of them charge higher tuition and fees than UTMB. There are scholarship opportunities, and we encourage you to go to the Enrollment Services website or to reach out to Enrollment Services by email or by phone with any questions that you have. So with that, we'll open it up to Q&A, and we wanted to end with an inspirational picture. So what could be more inspirational than envisioning a time when we can go back to the historic Pleasure Pier and ride the roller coaster one more time. We understand that, this is a unique time and we're socially distanced, but we look forward to a time when we can all be together again. So thank you for your attention, and we'll be happy to answer your questions.
Tria, I'm just going to start running through some of these questions, and if anyone can jump in. We see 29 questions in the Q&A, and I have a question: is anatomy and physiology okay for a substitution? So if you look in the prerequisite section, anatomy and physiology is required, and it's 4 hours of each, so you cannot substitute that for another course.
However, Christy, however,
yeah.
I believe that there's quite a few universities that have the A&P1 and A&P2, and we do have that. But
okay, but it's not a substitution for any other course listed on the prerequisites, though. Would that be correct? It's its own requirement. Okay.
But it could, A&P1 could work for human anatomy, and A&P2 could substitute for human physiology. On those two, make sure that it's a science majors course and that it's not a kinesiology course.
Okay, so what I'm understanding is it's combined in some universities and not two separate things.
Quite a few.
And that may be acceptable. Okay. The next question is about the CASPA application with prerequisites. not being completed? Can I submit the CASPA application with prerequisites not being completed? And if yes, by when do I have to have them completed?
So my understanding is that yes, you absolutely can apply. We do require that they be completed prior to matriculation. So if you're if you're a senior and you're still enrolled in classes and you haven't graduated yet, we still want you to go on ahead and apply.
I have a question from a participant that says, can cell biology substitute for immunology? And I would think those are two different courses. Shirley, Ms. McGraw, do you know anything about that?
I think I answered that for that person, but you may substitute for immunology, molecular biology, cellular, or embryology, or
Oh,
immunology and virology are highly recommended. The thing that
Okay.
gets to be a problem with that is if you use the cell biology for immunology, make sure that you're not counting on that for 8 hours of your biological sciences. Sometimes people say, but I have this. You can't count a course for 2 prerequisites.
okay. And then we have a question, would philosophy be included as a behavioral science?
No, you need to really have a sociology or psychology course for that.
Yeah.
All right. Is there an expiration date on how recent prerequisites must be?
That's new for this year. It's within the last 10 years.
And have you accepted any international students?
Yes, we have.
I think there is a specific resource, international students, or maybe foreign medical graduates actually, that they have to access. Okay, upon entering prerequisite fulfillments on CASPA, do I choose all possible courses that could fulfill the requirement, or do I pick one course? For instance, I took organic chemistry and biochemistry. Which one would I enter?
You could select one that you would enter, and then what we will do, if there's some kind of question that the description doesn't meet the requirements when enrollment services does their audit, then we could talk about that and look at the other course. I'm sure one of them would, but it would just confuse your application to enter both of those.
All right, and then the next question is, I have 6 hours of 2 different psychology courses, but no sociology. Will this satisfy the behavioral sciences requirement?
Yeah.
Yes, it would be 6 hours of sociology or psychology and/or. So you could have 2 sociology courses, 2 psychs, whatever would make your 6.
Okay, we did have another same question about A&P combined, and I believe that's been answered by Ms. McGraw. So the next question is elementary statistics. Is it the same prerequisite as the statistics that needs to be completed?
The key on statistics is in the course description, it has to say analysis of variance and or multiple regression, relationships between variables. That's in our self-appraisal checklist. If you haven't looked at that, that's a real handy resource for the UTMB PA program. Just make sure that the course description has those keywords in that.
Very good. So we have a question about the GRE. So we did talk about the GRE in the test section, and it is still required for this cycle. The PA-CAT is just recommended.
Someone had the question about, can I submit my CASPA and then submit my GRE later? And I wrote back that yes, because I know a lot of times I speak to people on the phone and they say, I submit my CASPA, but I'm going to take my GRE in August or something like that. I think you can. Someone else came back and said, wow. So I will check on that. You all might check with CASPA, but I'm almost sure that you don't have to have them both ready. The other thing to remember is sometimes GRE scores run very, very slow. So I would say you've got to have the scores in to CASPA so that they can verify them by September 1. So I would say to you, don't register for GRE much after August 1st to take it.
Very good. Next question is about the faculty coach learning groups and how many students typically are in each coach group.
6 to 7.
Okay.
Laura, excuse me, I'm sorry, not Dora, Christy.
Yes.
Are you looking at the open questions? Because there's a tab at the top that says open. There's 62, and then there's answered. It looks like you're going to the answered section.
Oh, goodness.
And so
Okay,
they're
yeah.
already being answered. So if you can go to the open, and
Okay.
yeah, and
I
then those are
apologize
the
for that.
yes, and those are the ones that are not being addressed right now.
Let me just address one that I see right now, since we've been talking about biological sciences, and it's a good question. Do you accept AP credit for biological sciences? AP courses, be careful with, because AP courses usually don't, they just have credit, CR given for them. We require that all prerequisites have a letter grade. That's an A, B, C, D, F. So AP courses generally will not fulfill our prerequisites because they don't have that letter grade. So be careful with those.
Okay, there's a question about inorganic, or what we used to call physical chemistry, fulfilling the chemistry prerequisite. And I don't think you can use inorganic for organic or biochemistry. Ms. McGraw?
There's a separate requirement for organic chemistry and biochemistry, separate from chemistry. Generally, what people use to fulfill that is a general chemistry with lab.
Mm-hmm. Okay, we're getting multiple questions about the PA CAT, about how it's weighted. Will it be used in future cycles, and how it affects your chances of receiving an interview?
So the PA CAT this year will not be factored into whether a person receives an interview or not. It's not required. This is a research year where we're gathering information about the PA CAT, and then we'll determine whether it will be something that'll be required for the future. So it's not required, but it's helpful. It gives us a good starting point to see where, what will predict your success within the program, but it just hasn't been around long enough for us to make it a full requirement this year. Ms. McGraw, do you want to talk more about that?
No, I think I think that you covered it. Yeah.
So as thinking about whether it's weighted or not, let me address that just sort of more generally. We want our PA students to be well-rounded students, right? So we want to see that you have volunteer experience, leadership experience, some clinical experience, as well as you've been able to demonstrate through your grades that you're ready for the rigorous program that's coming. But if you have experience in athletics or in music, or if you have a hobby or you volunteered with something, that's factored into whether you get an interview as well. We also read all of your essays, so really pay attention and write a good essay for us to read, because the essay is your opportunity to show us who you are, and it really gives us some insight. It makes all of the prerequisites and the things that you put in CASPA, they come to life through your essay. So do any of y'all, Professor Hawkinson or Cobalt or Hirsch, want to talk about your experience sort of reading the essays and going through applications?
I think it's important to show your spirit and not just list things that you've accomplished, but how you feel about things, how they've impacted your life, things that have changed your perspective, how you've taken maybe something you thought in the past and you received some new knowledge and how you integrated that into your thinking, and if it made a difference in your life or not. Those are the things we want to hear about. How does anyone else have any thoughts on that?
Sure. Well, you kind of said along the lines of what I would say, but even the when you're writing about your experience as volunteering or your shadowing experience, putting what you got out of that, and you're coming across in that area how the experience affected you, helps us to see as well, brings out the individual, your experience. So each area that you're putting in there is a chance for us to see your outlook, your view.
Yeah. And, we understand that this is very competitive. So if you've been out of school for a few years and you've gained some really good experience, show us that. Tell us how you've grown. Demonstrate to us through your writing that you're ready for this program and you're ready to take the next step in your career. We want to accept students that we know are going to succeed. And so this is your opportunity to.
So we're getting a number of questions about shadowing, volunteering, clinical experience prior to applying to PA school, and if virtual shadowing counts now in the world of COVID-19 and being on quarantine. And I would say it's all important, and yes. Any volunteering, so there's different categories, and if someone wants to jump in and talk more about how this is broken down in admissions, that would be helpful. So you have your clinical experience and volunteering, you have shadowing that you've done. So there are a number of different categories within the CASPA application that you'll need to complete. All of that is important. It's important too that when you're filling out the application, that you carefully consider where you're putting things and if they're in the appropriate category, and not to duplicate things from one category to the next. But shadowing physicians, advanced practice providers, really important. If you have clinical experience scribing in a hospital or providing direct patient care as a patient care tech, anything like that where you're hands-on, that's going to be very meaningful.
And I would say, when in doubt, go ahead and include it. If it's the difference between virtual shadowing and no shadowing, we want to see that you had some of that experience. So err on the side of telling us too much.
We are getting some questions about CASPA, the submission deadline, and the supplemental application, as well as accepting the GRE after the CASPA application has been completed.
I think I mentioned that before. I'm not sure. Someone thought that both, one of the people in our open house said that they thought they had to do it together. I'm really not sure. I think that when I've talked to people before, that they've taken they've submitted their CASPA and then signed up to take their GRE a month later or something like that. I would suggest you call CASPA or contact CASPA and see what they prefer. There was another part of that, Christy, I forgot what the last part of.
Oh, the GRE can be taken after the CASPA application has been.
And the deadline for both of them is September 1st, and it must be marked verified and complete on the CASPA application. So I had said before, GRE are sometimes slow on getting their scores in, so make sure you take it in early August, the latest.
Ms. McGraw, any issues that they have with CASPA, for example, not verifying their grades, even though the student has sent a transcript to them, that needs to be dealt with CASPA directly?
Correct. We can't intervene for you. I mean, it's your application, so you need to contact CASPA and talk to them. Okay.
Ms. Hawkinson, I'm getting a lot of questions about rotations, living arrangements for rotations, and do students have to set up their own rotations?
Students do not set up their own rotations. We have the students fill out when they orient before actually they orient for their clinical year. They generally are going to let us know along the lines of preference for going wherever, but wanting to be in have particular rotations in a certain, like geriatrics is what their passion is. They want to make sure they get that over location. Or a student might say, I prefer to be based out of Victoria. That's my stomping ground, or that's where I know I can stay. And so they may choose location as their primary preference. So they're going to arrange their housing. There's a little more to it than that, but the simplest way to say it is that the students do not arrange their own, able to put a preference in, like we just said, for either location or for the specialty that they want. And then from there, we try to work with them.
And I have a question about will they be on rotations with medical students or just only PA students? And are the rotations far from Galveston?
They can be. That goes back to what is your preference? Are you preferencing location over the specialty area that you want to be in? But obviously we have so much here in, on our own campus. And this is also where the Department of Corrections, Criminal Justice is. So we have many rotations that are here in our area or the medical center. So that's commuting distance. They'll be on rotations with other PA. There will be PAs at some of the rotation sites, or they may be with medical students. They're certainly going to have a mixture of other healthcare professionals where they're at.
Okay.
Or they might be the only student when they're on their site, because we have rural locations as well.
We are getting questions about the nature of our curriculum, and in the quarantine COVID world, are we going to be an online program? No. We are here on campus. There may be courses where your professors and course directors will have you do some online work or maybe some online lectures, but you will be on campus. We have not changed that part of our curriculum. Let's see, can PA students do research at UTMB? Let's see what else. And what does what does a typical prospective student look like? And does it help to have research either as an undergraduate versus clinical patient experience? How much volunteer work or medical experience is recommended? And I think those things depend on the student themselves. We have undergraduates who come in with clinical experience as an MA or a scribe or an EMT or, you know, something. And then we also have students who come in and they've been working full time in a different area, whether in medicine or some other tangential area. So they may not have as many patient contact hours, but they're bringing something just as valuable to the table through their experience.
And to answer the research question, on some level, it depends on what you consider to be research. The curriculum moves so quickly that there would not be a lot of time for you to, say, do a bench science rotation. But having said that, you'll take applied research, and the capstone, one of the kind of capstone courses is investigative studies, where you do clinical research and do some analyses of different articles and present a poster and write a paper on a critically addressed topic. So you're flexing those skills, but if you're talking about kind of wet bench research, there's not as much opportunity for that.
Christy, I see 2 questions that are kind of related down here that I'd like to go ahead and answer.
Sure.
One is, how many applicants do you invite to an interview? And after an interview, when do applicants know if they've been offered a spot? It depends on how many interviewers we have available that day, but generally we go anywhere from 20 to 40 people that come in for interviews. And how long does it take? The committee meets usually right after that. They don't always look at the group that was here that week. You may have interviewed in the first group and here, you know, a month later, we have the rolling admissions. So I always tell people when they come for an interview, you know, you may hear something right away. It may be several months. They generally keep the spots open, so they're not going to say, if you don't hear right after your interview, then forget about it. That's not true. The other thing someone asked is, what about if I applied before? What are my chances? And there are many, many very successful PAs that did not get into a PA program until their 3rd time applying. And it's just, and why is that? Sometimes I just like to say, it's because of the pool that you're interviewing with. I mean, the total pool, not just at UTMB, but at any school. Sometimes that's the reason. Or maybe the first time you applied, you didn't have a lot of your prerequisites yet, and you just are a more mature candidate later on. So always apply at many programs because it's highly competitive. And if you don't get in, don't give up. Apply again.
Mm-hmm.
And can I just add one thing to that? Apply again, but show us how your application is stronger now. Don't send in the same application.
Okay, we're getting some questions about, due to COVID-19, a lot of courses are being offered online as far as prerequisites. And are those going to be acceptable? And I would think as long as they meet the course description requirements of what should be covered.
The one key here is, and we've been asked this question, is that last spring in many colleges, you were given the opportunity to opt either for a pass-fail or for a letter grade for your course. If it's a prerequisite course, we need the letter grade. So if you opt for pass-fail, that's not going to count towards your prerequisite. The other thing about opting out for the pass-fail is that in the long run, sometimes that'll hurt your overall GPA or your science GPA because you'll have less courses to average into it. So it's your choice, but not on prerequisites. Those have to be letter grade.
And I would think that the question would also, or the answer would apply in some ways to taking a prerequisite, whether it's online or in person at a university or community college, as long as it fits the description of what needs to be covered.
We've always accepted distance learning courses.
Okay. All right. Let's see.
There's one question down here that's been down here for a while, and probably Julie, if you want to, is there an accommodation for students with disabilities when entering the PA program? I have hearing aids, and I was wondering if there's accommodations when doing coursework in clinical rotations.
Yes, absolutely. We comply with the Americans with Disabilities Act fully, and we want you to succeed. So we will make every reasonable accommodation to help you succeed within the program. Yeah, definitely. Absolutely.
There are some questions about the curriculum and how we are handling the rotations in the virtual setting, and if we, what was the other question? Do the students complete a master's project? And if we could answer those two, and there's another one that was somewhat related. I'll see if I can find that one.
There's not a specific master's project. Your course will be investigative studies, where you work within a group to write a PICO question and then do a literature review, write a critically appraised topic paper, and then present a poster based on your CAT paper. And we consider that to be kind of a capstone project. But you'll also come back, there will be a 3-part class called Advanced Professional Practice. And in that, you'll have some reflect, take some CME courses, prepare for the PANTS, and we do that in lieu of a master's project.
Several people have had the question about whether we have a preference on science courses or courses in general being done at a university or a community college. And I'll go ahead and add, or if they're at distance learning. I mean, this last spring, now there are more considered online distance learning, but previous we accepted those. And we accept any course that meets the prerequisite criteria. For instance, your science courses must be for science majors. Many times people is maybe they didn't, when they graduate and got their degree, and someone else asked, do you only have degrees that are science oriented or whatever? We've had a diverse number of people with different degrees. We had one person that was the first chair in the Oklahoma Symphony, so hers was in fine arts. So we have a diverse group of students that come into our program. Many times when they get their degree, they're not thinking, oh, I'm going to be a PA, so it's a later career choice. So yes, if they're not enrolled in one of the 4-year institutions, they might have to pick up those courses at a community college, or that may be where they can get them in the summer or something like that. So those are acceptable courses. They just need to be science courses and ones that are applicable to the prerequisites.
Okay.
Do you want to talk a little bit about the rotations, the virtual rotations? So the changes to the rotations due to COVID.
You were talking to me, right? Did I? Okay, because I caught part of that, and then when I thought, well, virtual rotations, she has to be talking to me.
And Professor Hirsch is actually a course director on a specific rotation right now. That's kind of interesting.
Yeah.
Yes, and we have virtual. I think one of the best opportunities is the COVID virtual rotation. So that one is definitely giving something that is getting you real-time information for dealing, with COVID. But what we have, I can speak more to the hybrid rotations that I'm doing in women's and children's. We have split so that our students are able to accomplish the learning objectives and the learning outcomes. We have the specific parts that can be covered. I guess if you think of like, you need to write a prescription for a pediatric dosage for a child, that is something measurable that you can do that's not just on the rotation. There are objectives that can be covered online. And so we have courses that are designed to help the student as we combine them together with clinical experience so that they're able to meet those objectives. It helps prepare them for the end of rotation exam, which helps prepare them, obviously for the boards. So that's what I'm doing in my block. I have students who are going to have the combination of experience. They're doing the clinical experience. I have them going into the rotations, but it's a combination together with online use of simulations and other type of virtual simulation tools and specific platforms that it's a combination of being able to virtually see a patient and be able to work through that information. And also we have in the virtual rotations, we have real preceptors that come in and speak with the students and have, you have audience and work through cases in that regard. So that's maybe kind of dabbling through and not real organized, but it's just, I want to be able to say we are going through organized and using, covering specific to a rotation or, covering what's already in the syllabus in the course, and we're using a combination of their clinical experience and the various modalities that we're doing online.
Ms. Hawkinson, could you talk about a little bit about how we evaluate them at the end of rotations? It's not just the EOR exams. I got a question about how else do they get evaluated? It might be a good thing to bring up the OSCEs.
Oh, thank you for that. Yes, then you put the ball over in my court, and I appreciate that. Sure, we have the OSCE, so the objective structure clinical examination. Those are, to me, that's a treat because we are able to do those virtually, or we can do those in, face-to-face with the standardized patients. We do that over at our Health Education Center facility, which has a huge wide range of simulation, and we have the students, they will have their focused OSCEs, which they're going to be able to assess a patient, and they're able to, they can do this, virtually or face-to-face. They're able to see the patient and be able to examine them and give us an appropriate, after they take the history and they document it, they'll be able to give us an appropriate assessment and plan. And this is something that we are able to grade as faculty. I guess I'm just thinking real kind of cut and dried. So we have the OSCEs, and we also have the learning outcomes, which that comes through, we tell the students that that's your golden ticket. That is what they have with their preceptor that has outlined very specific observed clinical skills as well as procedures that they are going to complete when they are rotating through at a specific rotation.
We just have a few questions left. Pardon me. There's a question that says, I've read around 95% of graduates have a job within 6 months. What could be barriers to a certified PA obtaining a job after graduating with their master's? And what types of clinical limitations do PAs have besides needing to practice under the license of a physician?
Can I speak to that?
Mhm.
So this also depends on where you want to go, because there's no lack of, you know, sick individuals needing health care. So it depends on geographically where the PA wants to go and what particular specialty. Are they going to go into a specialty, or are they wide open? So there's plenty of opportunity there, but your particular focus of, you know, location and what area you're going to go into is factors into where, you know, what's available to you.
We have a question about clinical rotations in pediatric dermatology, and do we have any courses with the medical students?
I think that you of course will have rotation clinical opportunities with medical students. UTMB has a very broad and diverse program in interprofessional education. So there are many opportunities that you'll have to work with medical students, nursing students, health profession students in courses and activities. We did have one course that was dedicated to the PAs and the medical students, but due to some changes in the medical school curriculum, it's not logical for us to take that course, and they're phasing it out of their curriculum.
Ms. McGraw, we got one other question that just popped up. It says, can we schedule phone conversations with an advisor? And I'm assuming that means an advisor with our program.
We don't have advisors to do pre-counseling. We usually refer you back to your university, because your university really knows what courses are going to be more applicable for you than we would know. I had one of the counselors call me the other day to talk to me about it. So I would refer you back to your university that you're with right now. We do not look at your transcripts or audit them until you're accepted for an interview. And that's across the board. I think for other health professions programs, that's the same thing, that UTMB waits unless you're accepted for an interview. And when you are here for an interview, we'll go over what you need to know. We do our interviews in the fall, so if you're missing a course or two, you have adequate time to pick it up that spring.
And there are some scholarships and financial aid monies available to you all, and I think you'll have to contact either Enrollment Services or the Office of Financial Aid and see what kind of scholarships, grants, and things are available.
And then it seems like a nice question to end on, what our graduates say is their favorite part of the program and what's been most rewarding. So from what I've heard, graduates talk about the diversity of the education, the strength of the Galveston community. We are a resilient community, being part of the UTMB legacy. And I'd like to invite y'all to share what y'all have heard from graduates too.
I think what I've heard is that they like our hands-on approach, the accessibility of faculty to them, that the class is a diverse class and looks like the rest of the world. And that they have felt this isn't easy and it's not for everybody, but once they've gotten out, they've said, wow, this was right. You guys got it right on the nose. This was everything we needed. So I think they're getting a very high quality education and a great environment from people who are passionate about it.
I think one thing that people are amazed is our class size is probably one of the largest around, I mean, in Texas, even though I hear that some others may be going to 100. that it's a large class, but it feels like you're in a small class setting. So much of the curriculum is, there's a lot of large classes, but so much of our curriculum is then focused down into small groups at labs or into the faculty coach learning team. So it really feels like you're getting a lot of one-on-one attention.
That's true, Ms. McGraw. They do have a lot of small, each semester they have small groups. So that's what we call them, you know, it's either small groups labs or it's small groups, but still lab, patient eval too. So sure enough.
And then those are facilitated or taught by core faculty PAs or other, you know, like Dr. Kutak said. Dr. Kutak and Dr. Guillory also take some of those depending on what the content is. So it's not that these are being branched out to teaching assistants or other students or things like that, that you have the opportunity to learn from a variety of professors here.
You'll be ready. When you graduate, you'll be ready. All right. I think we've answered everything. If we haven't answered your question, please don't hesitate to send an email to pasadmis@utmb.edu. Take a look at our website, and we look forward to seeing you soon. We appreciate your time and know that you are very busy, I'm sure, as we all are. So thank you so much for your time tonight.